I've heard people say the coronavirus crisis will go away when we get a vaccine. But what if people don't go and get that vaccine?
I'm a little 50-50 on vaccines. I think vaccines are great for life-threatening things. I'm 50-50 on flu type stuff.
We've all got neighbors like Jennifer Nuzzo, having to work from home, having to entertain kids, and a husband. She's anxious for an end to the coronavirus disruptions, but she's not convinced we can vaccinate ourselves out of it.
That if people do what they need to do, stay inside, wash your hands, keep distance, like any crises, we'll work through it.
She told us, from 6 feet away, she's hesitant about a potential COVID-19 vaccine. And we found, so is a lot of the US, which raises the question, will Americans actually get a coronavirus vaccine? Let's be clear about something. The US has strict regulations about bringing a vaccine to market, and science has proven time and time again that they're safe. They're also really important to the health of our community, because the more that your friends, your family, your neighbors gain immunity, even for a mutating virus like the flu, the more protection that you have, that your kids have, that the elderly have, some of whom may not be able to get immunized. But there's still a lot of skepticism about vaccines in America, and it's threatening our well-being. So LX, with our partners at Morning Consult, surveyed 2,200 people on the topic. And here's what America told us as to whether they'd be among the first, middle, or last people to get a coronavirus vaccine when one is approved and becomes available. Less than a third of the country said they'd rush to inoculate. 1 in 5 respondents said they'd be at the back of the line or they wouldn't get the vaccine at all. Some of the reasons we heard from around the country: I am 21, no past health problems. I'm all set, don't trust it. I don't think enough information is given about what is in vaccines and medicine in general. And we heard it from people in the coronavirus epicenter too.
I don't want to be injected with something that I can't control. So, you don't know 100% if it's going to definitely go away.
To assess the challenges of building America's immunity, I turned to an all-star panel of experts.
My name's Krutika Kuppalli. I'm an infectious disease physician.
Jennifer Nuzzo. I'm an epidemiologist at Johns Hopkins.
I'm Dr. Edith Bracho-Sanchez. I am a pediatrician at Columbia University.
Jay Wolfson, professor of public health medicine and pharmacy at the University of South Florida in Tampa.
These doctors agreed the FDA only approves vaccines once there's proof, beyond any reasonable doubt, that they're safe.
The data are clear. The benefits far outweigh the risks.
Vaccines are safe.
And if they weren't, I would never recommend that kids get them.
That's why it'll likely be 2021 before Americans can get a coronavirus vaccine. And even if it's not 100% effective, and even if you don't think you need it, health experts say everyone needs to hear this. It's not just about you. Vaccines are about protecting our community.
Family, my friends, my community members, in order to protect me from them and them from me, we have to have something called herd immunity.
Herd immunity. You're going to hear that term a lot over the next couple of years. An explanation of how it works, using the best I've got while working from home.
Herd immunity is when all the people inside my community bubble have already been protected either by having had the disease or by being vaccinated against it.
As more people become immune, there's less spread of a virus. But not every member of the herd can get a vaccine or survive getting sick. They count on the rest of us.
We have an obligation to others, in addition to ourselves, not to spread deadly and debilitating diseases.
So for example, a newborn baby that has not been vaccinated yet does not have immunity against, say, for example, measles or influenza. But if the disease is spreading in the community, it stops before it gets to the baby because everyone else is providing that buffer.
Diseases have been eradicated when they have nowhere to spread.
If you don't want to get the vaccine for yourself, do it for your parents, do it for your grandparents, do it for your friend that might be immune compromised with cancer.
One millennial in our poll said, "I would make it a priority because my family has weak lungs and herd immunity is vital for everyone." And the 19-year-old said inoculation was important because my community is currently being overrun. There's still so much we don't know about a possible coronavirus vaccine. Will it be 100% effective? Will everyone be eligible for it? How long will it take to get distributed?
That could be a year to a year and a half. I'm not changing any of the dates that I mentioned.
But when that date comes that we have an approved and safe vaccine, should the government require Americans to get it? More than half the country told us yes by a 54 to 35 margin. And no generation indicated stronger support than Generation Z adults aged 18 to 22. But in America, home of the free, there is no federally mandated medicine. So our panel says we're probably going to have to rely on each other when it comes to recommended vaccines.
I know some people very much fear the loss of autonomy. They don't want a perceived group of experts telling them what to do with their lives. But a decision to vaccinate gains them greater liberty.
Just because something is not required, it doesn't mean that it's not necessary. Have a conversation with your physician and keep an open mind as to whether you should get specific vaccines, even when the law doesn't require you to.
Our polling also revealed strong splits between men and women, with 60% of male respondents saying the benefits of an approved coronavirus vaccine would outweigh the risks, compared to just 49% of women. And when it comes to generational splits, seniors were the most likely to have confidence in a vaccine, but those between 45 and 64, much less so. One difference, most seniors are old enough to remember the polio scares in the 1950s.
Parents were afraid to let their children play together sometimes because they didn't want them to contract polio. I mean, I'm really hopeful the hesitation that we've been seeing for other vaccines is in part due to we haven't witnessed in our lifetimes the having those disease run rampant through our communities.
So one silver lining in the coronavirus crisis, a successful vaccine could help rebuff some of America's skepticism about the science.
What I hope that it does is that it shows them the importance of science and the importance of things like therapeutics and vaccines and why they are so important and life-saving.
And that some of the ground that we allowed the anti-vax movement to make is now taken back by science.
So there's hope in coronavirus research and hope that we can all do something to save lives. Whether that's listening to the concerns of someone who's skeptical of vaccines and showing them the science, or just doing our own part to get recommended inoculations to protect those in our community who may not be able to get them. Like the 56-year-old woman who responded in our poll, "I suffer from 2 autoimmune diseases, so I'm in the most vulnerable category."
The buck stops here. The buck stops there with each individual because the government cannot protect you. Each of our friends, our family members, has to take the personal responsibility to do everything we can not to put ourselves or other people at risk.
Remember, we're all in this together.